Hello, I'm Mark Curtis, and I have spent the last 30 years working with dentists to get information out to their patients and to the public about new techniques, new technology, and better options for better dentistry. But I will tell you something, in all of those 30 years, I have never been this excited about a topic. This is a game changer. This is going to change people's lives. In fact, it's going to change your life. It will never be the same. You're going to be able to go to sleep and then wake up refreshed and ready and on top of things. No headache, no tiredness, no falling asleep at work. This is going to change your life. So let's get going. Now, you're probably wondering, is this the right webinar for me? And I want you to know, if you're sick and tired of being sick and tired all the time, you should be on this webinar. Whether you are suffering from sleep apnea and can't wear your CPAP, or you are suffering because you have a loved one that can't wear a CPAP, you will benefit from this webinar. In this webinar, you are going to find out about a remarkably simple device that will treat your sleep apnea without a mask. There are no wires and hoses. It fits neatly into your pocket so you can take it with you wherever you go, and it's almost invisible when you're wearing it. Just imagine that. Would you get a better night's sleep? Now, if you're like most of our viewers, you are imagining peacefully sleeping in your bed, but I want to shake you out of that bed for a second. Visualize sleeping in the hammock on a sunny, sandy beach. Can you see that? Hear the waves. Feel that breeze. Yes. Wait. Come back. I almost lost some of you there. Can you imagine this with a CPAP on? Of course not. How about camping, family camping, sleeping in a tent on a family camping trip? Smell that crisp morning air as you wake up refreshed and ready for adventure. Your world is about to change. If you're like most of our patients, you're going to start talking about life before your oral appliance and your new life after you started wearing one. I am so excited about revealing this dirty little secret to you all. Why do I call it a dirty little secret? Because 95% of the people watching this presentation right now didn't know that there was anything other than CPAP that would treat their sleep apnea. Now, I'm not sure of the why, but I do know the what. And the what is that sleep apnea patients aren't told about this device. Even though it's FDA approved, even though it's approved by the American Academy of Sleep Medicine, even though it's recommended by the American Medical Association. To be honest, I worry every night about all of you who have sleep apnea and are not using your CPAP masks. If you don't even know about a sleep apnea dental appliance, what are you supposed to do? As far as you know, you have no alternatives and no idea where to turn. Most of you who cannot wear the CPAP haven't told your sleep physician that you can't wear it. Many of you are feeling guilty because you're letting yourself and your family down. You're sure that all the sleep physician will say is, you need to try harder. Some of you are making mental errors at your jobs, the kind of errors that could get you fired. Maybe you're even falling asleep at your desk, or worse yet, behind the wheel with kids in the car. The wonderful thing, though, is that you are here today, and by the end of this webinar, you will understand why you can't wear a CPAP. Learn about a simple device that will change your world. Meet a doctor who is trained to provide that device to you. Hear from actual patients whose lives were changed forever. And we're going to get your questions and concerns answered. And if you can stick around to the end, you'll find out about how you can earn a free gift. Dr. Jeffrey Cross is a general dentist focusing on sleep medicine. He's been in private practice for 39 years, and that doesn't even count the 3 years he was a dentist in the military. In 2016, he earned the AADSM, that's American Academy of Dental Sleep Medicine, accreditation as an accredited dental sleep medicine facility. At that time, there were only 56 accredited facilities in the entire U.S., and he has prepared sleep appliances for well over 200 patients whose lives he has changed. Welcome to you, Dr. Jeffrey Cross. Dr. Cross, I want you to do something for me. You had, before we did this webinar, you had shared with me some of your personal experiences with CPAP. And would you mind telling our viewers about that?
I started to read about dental sleep medicine about 7 or 8 years ago. And as I was reading things in the literature, it just seemed like it was such a nice way to help patients gain some healthy results that they weren't getting with the way they were getting treated, which was with CPAPs. And a further motivator, a big one, in fact, was the fact that my father, who unfortunately passed away 4 years ago, was suffering from sleep apnea. And he was relating to me that he had tried 3 different masks very unsuccessfully and just ended up just getting rid of them and refusing to try anymore. And I know that he would have benefited greatly from the sleep apnea therapy if he could have gotten it. Unfortunately, he had no teeth. He had what's called dentures. And at that time, 7 or 8 years ago, and even until 4 years ago, I didn't know enough of the techniques to make the appliance for people without teeth. It's really made for people with teeth. Subsequently, there's been more and more techniques developed for people that even don't have any teeth and have dentures, so that they can get comfortable with an appliance. But that was what I did, and I've really found it very beneficial. Both, it just was very rewarding for me to start treating patients and getting to see them become healthy.
But you were just too late for your dad.
Yeah, unfortunately.
I'm sorry
But
I'm
yeah,
sorry.
yeah. But hopefully, the knowledge I learned, I could help other people in the same situation.
So let's get right into this. I'm going to share my screen here. Tell me about CPAP.
As you all probably know, the most common treatment for sleep apnea is continuous positive airway pressure, what we call CPAP or BiPAP. The CPAP therapy is very effective only if you wear it on a nightly basis all night long. As our survey has revealed, many people find that they simply can't wear it for the whole night, or maybe not even 2 or 3 hours during the night. In fact, 76% of the people who are prescribed a CPAP machine have abandoned it after 1 year. The problem is, if you're not wearing your CPAP, you're headed for trouble. Some people have said to me, well, I haven't been wearing my CPAP for a while and I haven't had any problems yet. That may be how it seems, but eventually sleep apnea will catch up with you if you are not treating it.
How much do you have to wear a CPAP in order to get it to work?
You're supposed to wear either the CPAP or the oral appliance all night long every night. But actually, if you look at the definition of success for wearing a CPAP, the minimum success to them is 4 hours a night, 4 nights a week. So a total of 16 hours of sleeping with a CPAP is considered success, which is really horrible. A dental appliance with me, you have to wear it every night, all night long, and it's not hard to do. Patients very willingly and easily wear it all night long. It's not difficult to do, where CPAP is extremely difficult. That's why they have such minimum standards of success for it.
Doctor, before I forget, I'm going to bring up the opportunity to schedule a free teleconsult with you. It's a form here. I'm just going to bring it in, drop that down, and I'm just going to leave that up for a few minutes. You can see there's a stopwatch on it. By the way, a teleconsult is basically where Dr. Cross is in his office and you are in a nice, quiet place away from everyone where you can talk with him. And he uses your phone to look at your facial structure, look at, if possible, your airway and stuff like that, and just talk with you. If you think that this might be a good option for you, please go ahead and fill out that form. And by the way, Dr. Cross can only do 3 of these teleconsults a week. It's first come, first served. And if this week is filled, you'll have to try to get in on next week. If you think that's a good thing, start filling that out. Now, I know that there are people out there who are not comfortable putting their information onto a forum on the internet, and that's fine. That's why if you look over here, there's a telephone number right there, and that telephone number will go directly to Dr. Cross's cell phone. Sometimes he answers immediately, sometimes he has to return your call. But if you're thinking about getting a teleconsult and you don't want to fill out the form, pick up the phone and call. We're very fine with that. Doctor, I'm going to put up some pictures here of sleep apnea appliances. Can you tell us a little bit about them?
Yeah, Mark. There are over 200 different appliances that are approved by the FDA, and all of them do the same basic idea of keeping the teeth apart and the jaw forward. But there is great variations between those appliances on which one's that for your individual mouth.
Well, wait a second. Why can't I just go to Walmart and pick up a snore guard?
No one knows what's the ideal amount that the jaw is supposed to move forward. And you'll notice on these appliances that they have different ways to bring one element of this appliance forward, bring your jaw forward. Each of them has a separate different way of doing it. But they all do that to bring it forward, and it's called titration. And the doctor is the one that helps direct you on what to do or does it for you. Everybody's mouth is different. Some people have short teeth, others have long teeth, so you have to know what type of retention that you need in the appliance. Some people have bony structures that prevent certain type of appliances to be used. Other times people, you have to be careful of the musculature. There's a lot of different designs that will fit a particular person's mouth. So you have to really do your exam and figure out which one is the best. And that only a qualified dentist can really help you come to the right appliance for you.
Why is it that people have such an easy time using a sleep apnea oral appliance?
As it shows, it is comfortable, very comfortable to wear. It's easy to wear. It's quiet because there's no air being pushed around. It's portable. You just slide it into a small case and put it into your travel bag. There's nothing to go through security with, and it's easy to care for. You need is a toothbrush and antimicrobial soap, and that's all you need. And the nice thing is, over 90% of the patients are still wearing their appliance after 1 year, whereas with a CPAP, the people wearing the appliance after 1 year is very low.
So I've got this picture of a woman sleeping here. Is this a pretty good representation of what you look like when you're wearing it?
It's pretty close for not only her, but maybe even the person next to her.
Oh, that's true. I'm going to ask people out here, our viewers, it seems to me like that would be incredible. What would it be like for you, our viewers? How quickly could you get to sleep without having to set the whole thing up, put the mask on, tighten your straps, get comfortable, finally get done hearing the noise and drifting off to sleep versus sticking an oral appliance in your mouth and laying down? What kind of difference would that make in your bed partner's life? Not only that, but I have grandkids. I have 2 grandkids, and they come over and they do sleepovers with grandma and I. But when I had a CPAP, they didn't want to sleep near me or even in the same room. I would think grandkids would think, oh my gosh, grandma doesn't wear that weird thing on her head anymore. Cool. Doctor, I wanted, as we're talking about this, I saw something on your Facebook, and I'm going to read it. And you're probably going to be embarrassed, but I'm going to read it. Dr. Cross put me at ease. This is Terry Robinson Lemire, by the way. He put me at ease as he introduced himself to me. He is so down to earth and educated me on the use of the device. He was transparent with me that everybody's different and everyone's results would be different, but I went for it. And once they created the molds for me and the device was tailor-made for me, I tried it. I was able to do a sleep study at home to get a baseline of my sleep apnea. Yes, it was still severe before the treatment. Dr. Cross and his staff ensured that I came in for several appointments to monitor how I was doing with using the device. There was an adjustment period, but when my husband told me, listen to this, that I no longer snored at all, I was convinced that I had made the right decision. Finally, something that worked for me. Once I had been using the oral device for quite some time, Dr. Cross had me do a follow-up sleep study. I am so proud to say that I am now considered to have mild sleep apnea. I'll take that. My blood pressure is now controlled with a lot fewer pills. I have so much more daytime energy. I wake up refreshed. I no longer feel anxious about my sleep apnea. That in itself makes me so happy. Did you know I was going to spring that on you?
No, I really didn't, but it brings a smile to my face when I see it.
If you want to read the entire testimonial, I just picked out part of it because it is fairly long. It's right at the bottom of this page underneath the video. So if you take a look at that, you'll find out that Terry is actually a healthcare professional. So she knew that not treating her sleep apnea, not wearing her CPAP was endangering her health. And that's why she's probably extremely happy. And as she says, my blood pressure is now controlled. I'm going to ask our viewers, would you be willing to write a testimonial like this if you found out that, let's say, 2 to 3 months from now, you were going to sleep, your husband told you, or your bed partner told you, or your wife told you, or your dog told you, hey, you don't snore anymore. And you were waking up refreshed, energetic, ready to face the day. Would you be willing to write that kind of testimonial? You would be excited to tell everybody. What is so bad about sleep apnea?
Well, the problem is you stop breathing for 10 seconds or more. When you do that, the body needs to get oxygen. Your heart rate has to increase significantly so that you could pump the blood through the body with a diminished amount of oxygen. If you have less oxygen in the blood, then you have to pump more blood to try to get that same amount of oxygen. So your heart rate or your pulse goes up significantly with that lack of oxygen. So either your heart rate starts to go up, and if you have a heart problem, that makes it worse. Your brain is not getting the oxygen it needs. And what happens is your brain tells your body to wake up, not necessarily to wake up when you get out of bed, but you wake up enough so that your sleep patterns, instead of getting to that what is called the deep restful sleep, doesn't get there. You stay into a much shallower sleep, and that unfortunately is not the restful sleep that gives you that restful nice sleep to be active during the next day.
I think I've got a movie here that is pretty graphic, but it will explain a lot of that. Can you explain what we see going on here?
See, so right now there's a gentleman who's sleeping. He just took a breath, and now his airway is closed off, and now he's not breathing at all. And during this time now, your heart's still beating, so now it's beating less oxygen through. Now his body's starting to say, or his brain is saying, hey, listen, you got to breathe if you want to live. So you're having your chest walls, the muscles of the chest trying to constrict, and you have your abdominal muscles. And he still hasn't breathed yet. So his body is starting to scream to breathe. And now he takes that big, deep breath that he finally gets the chance to breathe. So your brain has to wake up your body so that it could breathe. But that gets you totally out of any sleep patterns of restful sleep pattern that you would hope to have.
Dr. Cross, that is our time for the presentation on this webinar. Now, I encourage those guests who would like a teleconsult with Dr. Cross to complete that form. Again, that'll only be up for a short time, as you can see by that timer. Sleep apnea oral appliances, seriously, they're remarkable devices that treat your sleep apnea without a mask. There's no wires, there's no hoses, there isn't any noise to keep you awake. It fits neatly into your pocket so you can take it with you wherever you go, and it's almost invisible when you're wearing it. And if you want the freedom to go anywhere and still treat your sleep apnea, you need this appliance. If you want a peaceful, restorative night's sleep, you need this appliance. If your sleeping partner wants a peaceful, restorative night's sleep, you need this appliance. And remember, I've said this before, if you are sick and tired of being sick and tired all the time, you should schedule a teleconsult right now. Schedule that. If you're suffering from sleep apnea and you can't wear your CPAP, please, please schedule a teleconsult right now. If you have a loved one that can't wear the CPAP, you can share this webinar on Facebook where they will see it, or send them to this webpage. You can give them the link and send them to this webpage. Tell them you got to see this. But I'm telling you, if you need it, schedule that free teleconsult with Dr. Cross right now. At this time, Doctor, I'm asking our viewers to stick around because we're going to be answering some pretty good questions that they've put into us, and you're not going to want to miss that. Dr. Cross, just to make sure I say this if I haven't said it already, I want to thank you for taking the time today to explain this all to us. While we've been talking, my staff has been taking the questions from viewers, and they've actually put together some cool slides. So I want to show you some slides and some questions. Are you ready?
Absolutely.
Okay, here we go. Rob from Baltimore wants to know, do people really die from sleep apnea?
Yeah, unfortunately, many people, many more than the pictures you see up there right now. But if you'll notice, there's Carrie Fisher from Star Wars fame. There's Reggie White, who was one of the most amazing football players of all time. He was for the Green Bay Packers. There's the star of the HBO series The Sopranos, James Gandolfino. There's one of my favorite people of all time, Jerry Garcia of the Grateful Dead, and Supreme Court Justice Antonin Scalia are just some of the many, many people that have been in the news of dying from this illness.
Here's another question for you. Tran asks, how is snoring different from obstructive sleep apnea?
Snoring, you're still getting air going into the body. What happens is it's just a reduction of the tube. The tube gets smaller from the tongue falling back against the back of the wall. So you're having a restriction of airflow, and that causes the tissue to vibrate. And that's what the snoring is. So, but you're actually breathing at that point. You are getting air into your lungs. Sleep apnea, there's a cessation of air going into the lungs. That's an apnea, is when the air totally doesn't enter into the lungs.
Nicole asks what I'm sure is on everybody's mind. Does dental insurance cover oral appliance therapy?
Nicole, that was a really good question, and a lot of my patients ask that. Sleep apnea is a medical condition. It's not a dental condition. As a result, there is no dental insurance that covers it, and that's good because dental insurance has very limited coverage. Medical insurance, on the other hand, has a lot of coverage, and most medical, if not all medical insurances, do cover for sleep apnea, including Medicare. Medicare is a big supplier of sleep apnea coverage. When you come to me, I actually submit your claim to your medical insurance. For patients that have private medical insurance, before you even have the appliance constructed, we pre-authorize through your medical insurance your coverage so you know ahead of time exactly what the cost out-of-pocket expense would be, if any.
Chandra asks, if I have to have another sleep study after I get my oral appliance, do I have to have one that requires all those wires attached to my head?
No, not necessarily. A lot of the medical insurances and even Medicare now accepts the home sleep test as a value test to determine sleep apnea. The ones that you're referring to is ones that are in a hospital-like setting, or at least in a clinical setting where you're not in your own bed, you're not in your own house. The home sleep test is in your own house, your own bed at the time that you decide to put it on. It's much more convenient. You know, it's still a little bit annoying, but it's nowhere near as annoying as the testing that are done in a facility. A lot of times that's all that's needed to get the diagnosis of sleep apnea.
And another question that I know goes with this, do they have to go back to their original sleep doctor?
Since I always believe that you should stay with your own, practitioner, I would encourage you to stay with your own sleep doctor. Having said that, if you feel that they're not providing your needs, we do supply you with other sleep physicians that you could get your diagnosis from. We have ones we work with in Maryland. There's ones that do teleconference, telemedicine for you, so that there is not the need to see your sleep medicine doctor. But I do emphasize that if you're comfortable working with this physician, I strongly encourage you to stay with them, and we'll just work with them.
Okay, I've got one last question.
Okay.
Can I use an oral appliance if I'm an over-the-road trucker? And that question, I'm sorry, is from Andy.
The DOT, Department of Transportation, requires that commercial drivers must track their sleep apnea. They could use a dental appliance as well, but they have to have this embedded chip. At the present time, we have to embed a chip, so this computer chip can be read by their sleep physician to determine that they are compliant with their sleep apnea treatments.
Dr. Cross, that brings us to the end of the questions that we have. And I want to thank you. I want to thank you so much for getting this information to us. And I'd like to thank all of our viewers as well. If you stayed on until the end of the Q&A, I appreciate that. Oh, wait. I almost forgot the free gift. If you look over on this page, you'll find a Facebook logo. And if you click on that, you can recommend this webinar to your friends on Facebook. And we will actually get notification that you did that. You will get a document, a PDF document. You'll just need to call in your name and address, and we will send you a $10 Starbucks coffee certificate. So if you'll hit that Facebook button over there, share this with your friends. You need to do that. People out there who don't know about dental appliances will thank you. I'm going to put this next slide up again because I want to finish with this slide. And I'm not going to read it to you, but I encourage you to read it through again and to register for that free teleconsult. And so at this point, I'm going to say, Dr. Cross, thank you. I'm going to say goodbye to our viewers, and here's to a full night's rest.
Good night, everyone. Thank you for your time, and I'm looking forward to trying to help you with your sleep apnea.